Yes.
Okay, perfect. Um, Hi everyone. So before we start, I just want to let everyone know that we have translations in Spanish available. So I request you to turn that on if you need, and also that the session is live and it's being recorded. So before without wasting any more time, welcome to today's discussion on financing the care economy, focusing on why it is important for the rights-based economy. This is an NGO UN Commission on the Status of Women side event, where the theme for this year is accelerating the achievement of gender equality and the empowerment of all women and girls by addressing poverty and strengthening institutions and financing with a gender perspective. This event is also linked to the Global Days of Action campaign 2024, where the theme is taxing fairly for gender transformative care. So now, before we get started, very quickly, what exactly is the care economy? So care in itself is a two-pronged concept, and it refers to paid and unpaid care work provided by people as part of human survival, welfare, and reproducing the labor force. So on one hand, it is the provision of unpaid care work by the households and communities, and on other are paid jobs in the care sector, where both sides are disproportionately represented by women with precarious working conditions and often lower wages. Now, there's an overwhelming consensus and data that most of the unpaid care and domestic work are performed by women, um, who end up spending almost 3.2 times more hours on unpaid care work globally than men, while women in countries of Asia and the Pacific spend up to 4 times more. Also, during the pandemic, care work exacerbated, and estimates reveal that women have done 29% more childcare per week compared to men during the pandemic, leading to a drop in women's participation in other areas of life, including political, social, and economic participation. So, over the last 2 years, the Financial Transparency Coalition has analyzed government spending on COVID recovery, comparing it to the benefits allocated to the corporate and private sector. The years of the pandemic reveal the need for investment in the care economy and why it is the backbone of development that is sustainable and rights based. So, this year, the FTC has looked into fiscal policy side of the care economy, and for conducting the analysis has had to delve into the legal and policy aspects of the care economy across regions. So in this conversation today, experts from across diverse regions and contexts will discuss the nuances of the care economy and will showcase the existing financing situation based on their research findings. So we have with us today Ishmael Zulu, who is a policy officer, tax and equity at the Tax Justice Network Africa. We have Meggy Katigbak, who is research and program staff at the Asian People's Movement on Debt and Development. We have Klelia Guerrero Garcia, who is the tax justice specialist at Latin American Network for Social and Economic Justice, and Sanchari Mukhopadhyay, who is the policy analyst at the Center for Budget and Governance Accountability, New Delhi. We also have with us Veronica Serafini, who's a feminist economist and specialist in gender and macroeconomics at Latindadd. So I now request each of the speakers to very quickly share their opening remarks, followed by interventions and questions by our discussant Veronica, after which we will open the floor to any audience questions. So may I first invite Ishmael to start the discussion?
Thank you. Thank you so much, Sarah. It's a pleasure to be here. As been introduced, my name is Ishmael Zulu. I work with the Tax Justice Network Africa, which is based in Kenya, in Nairobi. But I'm Zambian by nationality, which is in the southern region of Africa, and I'm based in Lusaka. So once again, it's an honor and privilege for me to be sitting on this panel alongside some very well accomplished economists who've made some very strong contributions to the topic of gender and taxation, to the topic of the care economy specifically. And this is something that is increasingly weighing heavy on my heart because from a personal perspective, last year I was gifted. I had a daughter with my wife. She's 1 year old. She's 1 year old now, and increasingly, in understanding the current economic situation, I'm constantly thinking and wondering what sort of world I'll be raising my daughter in terms of how difficult it is, how much more difficult it is to be a woman as opposed to being a man. Some of the challenges that she'll face in terms of accessing education, in terms of accessing healthcare, and even just in her day-to-day life. And in speaking of the current storms that we're facing in today's economy, it's particularly worrying because we are yet to find long-term solutions to the challenges that we are facing from an economics perspective. A lot of the solutions that we are seeing now are stopgap measures that have had adverse long-term implications on inequality. So unfortunately, those at the bottom are most affected by these stopgap measures. Now, for instance, in terms of a solution for inadequate public tax revenue, a lot of governments are relying on consumption taxes, even though they have been shown to predominantly be regressive and hurt low-income earners, and the majority of which many are women. And when you begin to break down the burden of taxation, be it whether it's women or men, whether it's the wealthy or the impoverished, whether it's individuals or it's the large corporates that are bearing the burden, unfortunately, you see that the burden is being borne by those that are most vulnerable in society. And ideally, tax policy should reflect the existing material conditions under which various groups are living in, such as the women and the men. Our tax policy should reflect this, but this is not always the case. So for us on the African continent, we focused on Ghana, Zambia, and Kenya. And these countries are facing very similar economic conditions. When you look at their debt burdens, their engagements with international financial institutions such as the IMF and the World Bank. And from the findings that we see that governments in these countries have had to adopt regressive tax policies based on their respective debt positions. And in these particular countries, even the gender dynamics, there are significant gender gaps on account of different legal restrictions and non-legal barriers to women's access to education, health, and financial services. And the strained economies within which these governments are facing have limited their ability to provide social services. The challenges that have been there in terms of providing social services can be highlighted by some of the regressive tax policies that these countries have had to introduce on account of their engagements with institutions such as the IMF, which has made these countries focus on indirect taxes, such as taking up consumption taxes, which, as has been highlighted, tend to have a negative impact on those that are most vulnerable, specifically on women and children. So when we look at these regressive tax policies, they have long-term implications on inequality. And this is what some of the findings have found. And even in recognition of the importance of gender equality, a lot of these countries have put in place several policies to try and bridge that gap. But then, unfortunately, because of the economic storms that we're facing, these countries are not able to raise adequate tax revenue to fund these activities that are going to promote gender equality. And then now we turn and look at the regressive side of the tax policies that the tax systems that we have in these particular countries. And in the research, we found that there's a lot of reasons to this. There's inadequate education, which would then promote voluntary compliance from the general public. There is staff capacities in some of the revenue authorities. There is high-scale levels of tax avoidance and tax evasion. And this is particularly worrying because on and on we've showed how countries are losing close to 100 billion US dollars annually. This is on the African continent through illicit financial flows. We've seen how at the same time we have people that are increasingly falling into poverty because of the economic conditions at a global scale. But then at the same time, the number of those that are rich and wealthy on the African continent has significantly grown. I think the African continent has recorded the highest amount of growth in terms of millionaires across the world. But our tax systems are not able to keep up with the changes in the way people are earning money. So there is a continued gap between the rich and the poor. And of course, unfortunately, this has inadequate gender dynamics. So in account of all of this, as I try to summarize, we are changing how we are looking at feminist economics. We're changing at how we are looking at the way we look at our tax systems. So in cognizance of all of this, when you take these aspects, you try and establish a link between tax justice and the realization of rights, such as when taxes are fairly raised and fairly spent, they enhance equitable gender outcomes. Essentially, what we want to do is six things. Improve access to life-saving health services for women, reducing the burden of unpaid care work that is disproportionately borne by women and girls, as Sarah mentioned in her introductory remarks. Thirdly, improving the chances of quality education for gendered groups. Fourth is mitigating against gendered violence. Fifth is improving access to resources, including water and land resources. And lastly, improving women's access to social protection. So when you take all of these things into consideration, this is essentially what the tax system should help contribute to. However, there are still a lot of gaps, and there's still a lot of work to be done, which hopefully through this research, we can inform some of the policies and decisions that are being made at national level, but then also at global level. I will end there for now. Thank you. Thank you very much.
Thanks so much, Ishmael. Can I now very quickly request Meggy to come in with her comments and points?
Yes, thank you, Sarah. You mean start with my presentation, right?
Yeah.
Okay. So I will be sharing screen if that's fine. But it has been disabled. So okay. I think I can start. But if it's possible to share screen,
Yeah,
let me know at any point.
it is
Yeah.
possible. I think you're a co-host, so I think you should be able to share screen. Go for it.
Okay. So far it's been disabled, but I think I can proceed without the presentation. I'll just sort of provide the brief background. So good evening, everyone from where I'm from. Good morning to those in the West, and of course good afternoon to those in other parts of the world. So my name is Meggy. As Sarah mentioned earlier, I'm from the Asian People's Movement on Debt and Development. For our side, from our side of the country, or of this of the world, APMDD focused on three countries, which are Nepal, Pakistan, and the Philippines. But for now, I will be discussing the Philippines for the sake of brevity. So in the Philippines, like in all parts of the world, as Sarah mentioned earlier, it never was it so, or never was it so obvious how significant the care economy is in ensuring our survival. But we did have some issues trying to quantify the care economy, because it exists in every aspect of our social, economic, and political life. And so care exists in every aspect of our life, and so it is hard to quantify, and it apply, or rather it reflects in our laws. We don't have a specific law in the Philippines, or a specific policy, or a specific document that touches on the care economy. Rather, we have several laws that touch on specific parts of the care economy, whether paid or unpaid, whether it is to support those in need of care, like PWDs, senior citizens, children, people in need of healthcare, or those providing care, which are healthcare workers, daycare workers, unpaid care workers, women, daughters, fathers, and such. What we found in our research in the Philippines is that there seems to be the operative word being seems to be an enabling legal environment which should again, the operative word is should provide care and support to, on one hand, those providing care workers, women, unpaid care workers, daycare workers, domestic workers, and on the other side, those in need of care, which are children, senior citizens, PWDs, and those who are sick. And again, the operative word being seems and should, because on one hand, you have the legal policies or the legal environment and the policies. On the other hand, there is the reality, no, how it's being implemented, and how there still remains to be a severe lack of access on healthcare in the Philippines. I think what most people used to say during the pandemic was, if you get COVID and you survive, then the virus did not get you, but your medical bills will definitely get you, because that's if you are hospitalized due to COVID, which is scary in itself, that will amount, usually your bill will amount to about 1 million to 2 million pesos, which is about $20,000 to $40,000. And for a Filipino who earns about for an average Filipino who earns about $400 to $500 a month, that's a huge amount, no? So there still remains to be a severe lack of healthcare. Of course, in the Philippines, like in many parts of the world, unpaid care work still remains to be unrecognized within our legal framework. Even if the Philippines is the top one country in Asia to be part of a global ranking or a global index to eliminate the gender gap. That is how advanced our laws should be. And it is a part of the top 20 in the world. Unpaid care work still remains to be unrecognized and undervalued. And another big issue in the Philippines is that healthcare workers there's still a huge migration of healthcare workers, domestic workers, caregivers, and it's not just like an economic thing. Within medical schools and even in the healthcare industry, healthcare workers starting from medical school are all encouraged to leave the country, despite a severe lack of healthcare workers in the Philippines. They're all asked to leave the country because migrant workers or overseas Filipino workers provide higher, or rather, we call them our modern day heroes. They provide a huge subsidy. The remittances provide a huge subsidy to our economy. And so there's a huge contrast between the laws that are provided and the reality that is happening. And again, aside from that, access to healthcare is mostly concentrated in rich communities, in rich cities, and the realities in the province and far-flung areas are much different than how you would sort of in poor areas. Many people opt not to go to the hospital because of the huge fees of hospital bills. And what happens is that it is the women, it is the mothers, it is the daughters, it is the sisters who have to carry the burden of a lack of the lack of budget for healthcare work. I'll try to see if I can flash the screen again. But okay, so it's still disabled. I'm sorry. I wanted to show the list of laws. There's a long list of laws that we have that sort of provides. We have a Domestic Workers Act following if I'm not mistaken, the ILO Convention C-189 to provide labor rights to domestic workers. We have the Magna Carta of Women. We have the Magna Carta of Public Healthcare Workers. We have the Magna Carta of PWDs. We have Women in Development. We have the Early Childhood Care and Development Act. We have Health and Nutrition of the Mother and the Baby Act. We have the Solo Parents Welfare Act. We have Universal Healthcare Act. We have expanded maternity law, paternity leave, Senior Citizens Act. We have social pension for senior citizens. All of these supposedly geared towards the provision of services and the provision of support for, again, like I mentioned, on one side, those providing care, on the other side, those in need of care. And they should be reflected in the budget as they are laws and policies. However, despite these sort of, like I said, despite the enabling legal environment, the reality is that the people benefiting, let's say, from maternity care, from maternity support and paternity support, are usually the ones who work in the formal economy. And in the Philippines, like I believe in many developing countries, most women only have access to work in the informal economy. And women working in the informal economy and people working in the informal economy do not have that access to maternity support, paternity support. We also have senior citizen support. So there's the 20% discount on health and other services. There's social security allowance. Again, which as we found, despite all of these support for senior citizens, nearly half of the 9 million of elderly in the Philippines continue to work despite having worked all their lives. They continue to work but are still considered poor. Imagine working all your life and you're still working as a senior citizen and you're still considered poor. And many senior citizens do not seek medical support because of financial reasons. Again, there's still that inequitable access to healthcare. Child support is also, or rather, we do have a healthy sort of environment for child support. There are tax deductions, but of course, again, it's only available for people or parents working in the formal economy. And there's also resources and funds allocated to ensure the health and nutrition of a mother and her child for the first 1,000 days of the child's life. But upon the enactment or the ratification of these laws, so there are still no progress in infant and maternal health. Malnutrition in the Philippines is still a big problem. Access to water, access to food is still a big problem, especially for infant children. We also have disability support. Disability support, meaning those, how it works is that there is also those caring for people with disabilities are also provided the same benefits and tax deductions as the ones who have children. And people with this, schools and all institutions receive tax deductions if they sort of, especially private institutions, receive huge tax subsidies if they sort of create PWD friendly infrastructure. No, but despite these, a lot of PWDs still lack access to medical services despite the discount. And they are mostly self-employed or work in the informal economy because, again, despite these tax breaks, despite these tax cuts, despite the disability support available, not enough budget is, despite it being in the legal framework and it should be part of our budget, it is not being implemented correctly. And why is this so? Or how is this so, rather? Of course, we can all debate on why it is so. Corruption, illicit financial flows, the intervention of IFI's privatization. But how is this so? What happens is that we found that in several, through a validation study with women, with a women's group, we found that implementation of these laws, first of all, that not many people know about these laws, and so they do not know how to, especially women, especially the poor. When we presented these findings to the working women, they said, "Well, these are beautiful laws, but we don't know about them. How can we access them?" No. And second, there's lack of knowledge, and it is not implement. Well, of course, local corruption is a big thing, no. But also there is a severe lack of budget for it, despite the fact that it should be. For example, daycare centers should be free in the Philippines. In each barangay, or barangay as in the lowest level of community in the Philippines. But so far, a lot of the women who we who we spoke with said that as rather, instead of it being help to us, the daycares are actually add burden to our everyday work, because
Meggy, I just
sorry.
request you to wrap up because you've gone a little bit
Sorry.
over. Yeah.
Oh no, I'm so sorry. Okay, actually that's about it. Just so this the accessing these service have become more of a burden. So that's the point, to the women, rather than support. And of course, class discrimination plays a big part. Whenever they access these services, they're not given, or rather they're not given the support that they're needed because of class discrimination. There's always that factor. So yes, sorry for going over time, and that's it for me. Thank you.
No worries, your comments were very well received. I'd request Klelia to now come in. And Klelia, would you need to share your presentation?
Hi, Sarah. Yes, I do. I do have permission though.
Okay, just see if you're able to share screen, because I think we've made you host at the moment. Yeah.
Perfecto. Bueno, yo voy a hablar en español. Muchísimas gracias por tenernos acá.
Great. I'm going to speak in English. Thank you so much for having me here and for organizing this event. Personally, I believe that not only personally and professionally, it's very appealing. I feel this is as a huge responsibility to share the findings of this process in Latin America. In our situation, we've worked directly with 5 countries, and we have coordinated with the 6th country, which is Argentina. The rest countries, the countries are Mexico, Brazil, Guatemala, Ecuador, and Mexico. After these findings, these preliminary findings, I will share just some general conclusions that we've been collecting during the process. I believe that these have 5 important points: information, it is interventions, institutions, implementation, and impact. Based on these 5 most important points, I believe that the critical aspect of the timing, and also the lack of segregation that we have when measuring we're talking about social services measures and care measures, because of some update issues and training within the public institutions. What do I mean about this? In terms of segregation, that has been highlighted previously, that usually measures they don't take into account the situation of the population, but there have been various interesting initiatives, like measuring the time, like satellite cuenta of the non paid care services. That happened once, and the information is not updated. The dates go back to 2012, 2015. So lastly, what I mean by education here, like in most countries, especially in Central America, public authorities, when we talk about care, they don't understand right away what we mean by that. It's not something that they use daily. That is a problem also for those decision makers. Secondly, we have interventions.
Sorry. Hello. Hello.
Regarding interventions and the actions that the countries have taken regarding care, some movements have been carried out, but they have been very small, reduced. There is lack of access, and the information is not spread out accordingly. Even if they try to have it for community to have access to it, it's not being fulfilled yet. Mainly, the issues are because of their budget. Now, talking about implementation, there are some movements, like, for example, in Ecuador, it was mandatory to register with Social Security the domestic workers, women. When it was mandatory, it was being done. But now, 5 years later, it's again to where it was before. So in the long term, nothing was really done. They found the way to break the law. That happens a lot. When we're talking about institutions, Meli was mentioning something of that. In Latin America, we noticed that there are some rules and laws, like in Ecuador, last year was a law was declared mainly for care. It's not a system per se, but there is a law that demands from institutions to carry it out. Like there is not that clear, but they just say that entity A, entity B, do that, do this, do that, and then they have full responsibility, but none of them do much about it. And even if they want to, we go to the third point, they have budgetary restrictions. Most of the government entities are not abide or linked to budget resources. And this is where we go to the tax issue, because there is no way for implementation around care or another subject that has to do with tax that can be held throughout the time, and to get to the population that we are expecting to get it. And this is where we go back to the previous research we did, because in terms of taxes to wealth, because the last findings that we have, like value-added tax is what they mentioned, and there is a sense of unclear and uncertainty because there is an emergency. They're charging the population, but they are charging the wrong people. And I am going to mention something important. Care measures are not supposed to be covered with temporary or emergency actions. They cannot be seen like that because the problem of care is cultural. The problem is long-term, and they have to overcome election periods, something that has to be built. With one law, they're not getting the impact that we're expecting. Has to do with institution, education, resources. If we get them all together, then we're gonna see a change. And then now to close, the impact, I was mentioning restrictions, some initiatives that we see, they are informal. They are under the ministries of work or labor, especially with subjects of social work, and they don't reach most of the population, because 70% of the population is working informally, and especially women, because they're not only working formally, but on and off, because their main job is at home. If they are working only if they depend on their situation at home, if their parents are sick or not, their children are sick or not. So we don't have like certain numbers with this, but we cannot focus only in the formal labor. I believe it's important when we're talking about impact to understand the measures of the different implementations that have been carried out. Some of them are linked to resources, but probably few ways to access those, but also because of the poor design of these policies, and it happens often. Those who are the beneficiaries of the policies, they don't always have a say in when the laws are being made. And that is why we see recurring gaps. And we find out that a program or a law is not efficient because of the way it was designed, because those that will benefit from them didn't have a voice to say this is how we need it and why we need it. And lastly, invisibilization regarding this problem, it's close, it goes hand by hand with information issue. It's not that known because the methodology is poor, and the information that we have is not, the information people have is not part of their daily life for politicians or for the community. The lack of visibility is an issue because it doesn't make it a priority. So when the laws are made, people lose interest for them to be implemented and carried out. People want them for them to be implemented, but not from people from the top bottom. This is all I have to share today. Thank you.
Thanks so much, Klelia. I'd very quickly call upon Sanchari to make her presentation and interventions.
Okay.
Are you
Hi,
able to share?
everyone. Yeah, I'll just check once. Let me check. Can you hear my screen? I mean, can you see my screen? Sorry.
Yeah.
Yes.
Yeah, okay. 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 So, hi, everyone. I'm Sanchari from Center for Budget and Governance Accountability, and my care economy narrative is of India, where we think the fabric of care is crafted with the tradition and modernity. So just just the story, I mean, to start with the story of care. On one side, we have this age-old tradition of joint families where care for each other is not just expected, it is rather a way of life. And on the other hand, we are also embracing modern solutions like professional daycare and elderly care services, which is increasing after the pandemic specifically. But this duality also provides a ground for understanding how care is valued, provided, and integrated into the overall broader socio-economic framework. So it presents both an opportunity and also challenges as India attempts to integrate various models towards a cohesive care economy. So to start with, okay. To go to the next slide. Okay, yeah. So I'll just give you an overview of the overall care economy fabric that I was talking about. And mainly, I'm going to make 5 important points here. So the first point is that our care economy is characterized by a mix of both formal and informal services. So the formal services are typically government sponsored and regulated, while the informal care often are more familial and community based, which lacks official oversight. So challenges lies in quantifying and integrating this informal contribution into the broader economic framework. Second is the fact that the care economy within the household often hinges on women, positioning them as the primary caregiver. This is also a reflection of the kind of social norms we have that mostly associate care with female roles. Also, as if I quote data collected by government, women spend 299 minutes per day on unpaid domestic services for household members, as compared to 97 minutes by men. So this is something we should be really focusing on. Third point is about the community healthcare service providers. We call them Anganwadi and Asha workers, who represent a bridge between the communities and the formal health system. So their role are very important in primary healthcare delivery, but also raises question about the support and the kind of remuneration or benefits they're getting for such critical work. Other than this critical healthcare professional, fourth would be the domestic workers, who also form a significant yet informal part of the workforce. So in absence of the formal labor protection for these workers, they highlight the gap within the labor laws and policy reforms that is needed to protect and recognize the care workers. Finally, I would like to highlight on the double burden aspect of the care work, which is mostly shouldered by women. And this also underscores a disparity in terms of the distribution of unpaid and paid labor. So from this overall characterization, moving on to the second part, which talks about the policies that are there. So let's navigate through the blueprint India has laid out for care overall. So India has a few important policies supporting care. One of the prominent one is the Maternity Benefit Act, and along with Maternity Benefit Act, there are also national policies that aims to talk about children care, elderly care, and disabled population as well. So other than these prominent area that talks about care directly, there are other prominent policies as well that talks about the minimum wages or unorganized workers, Social Security Act, and also sexual harassment of women at workplace, and many other in this sense. Which advocates for increasing participation of women in labor force, also sets the ground for caring for women's agency and helps in acknowledging the significance of care work as a whole. So there is two parts. One is core policies that directly talk about care work, and there are other enabler kind of policies that talks about the significance of care work or acknowledges the significance of care work and somehow incorporate them. I should also mention here that recently in 2019, we also have a national policy of domestic workers. However, it has not yet been notified. Having said that, I mean, all the policies you can see in front of you, I mean, there are other less significant ones, if I can say so. The effectiveness and reach of these policies are subjected to ongoing analysis. For instance, despite legislative support, only a fraction of women in workforce can really access the benefit provided by Maternity Benefit Act because of the vastness of informal employment sector. So the goal is to understand how well these frameworks translate into tangible support for those who remain at the heart of the care economy. Next, I just wanted to show you some schemes and provision, and mostly, I mean, it's very difficult to give you a particular number in terms of care, how much, I mean, in terms of budgetary allocation, but I can tell you that what are the areas that the budgetary allocations are going into, what are the schemes or programs that they are focusing in this aspect. So they have, I mean, India is investing in many care-related programs, which highlights its commitment to this sector, particularly since the pandemic. So other than women-specific schemes, there are also child-related schemes and schemes for elderly care and also for the differently abled population. Schemes generally revolves around benefits like providing cash assistance to mother, then nutritional supplements to pregnant and lactating women, as well as employment benefits for women, for example, provision of creches at the workplace. However, in an indirect way, as the cash assistance may not have the actual effect of reducing the overall burden of unpaid care work, a few schemes are also there which aims to reduce the drudgery in the household tasks and to free up the time for paid work. So in this line, we also have substantial budgetary allocations towards providing tap water connection to every household, or providing cooking gas connection to every household. Which specifically aim to reduce drudgery part of it. Also here, I would like to mention that the economic valuation of unpaid care work, which significantly contributes to the GDP, remains a challenging frontier. Recent surveys suggest that 60% of women's work in India is unpaid compared to 12% of men's work. Domestic work also forms a very crucial aspect. Recent estimates again suggest there are over 4.2 million domestic workers in India, and majority of those are women, highlighting again the gender nature of work that I was referring to in the beginning. So coming to the end, I would like to reflect that the road ahead involves critical examination and adaptation. We are planning for a better future, but it is about building an infrastructure that is not only supports, but also values care work in all its forms. So achieving this requires ongoing dialogue, targeted investment, and a clear-eyed assessment of existing barriers. I'm going to reflect on a few here. So first is the need for a comprehensive data for care work in India, which is not available at the moment. Second would be that the fact that care economy is highly fragmented between individual caregivers, non-governmental organizations, and the government. So this needs to be addressed first. Third, there is a need for policy integration and coordination. So here I should highlight that addressing the needs and right of the domestic worker is key to fostering the inclusive care economy. And fourth and last would be the cultural and social norms that are highly entangled with the care economy in India. Care is often considered as a sole responsibility of women, and it also has a regional aspect to it. So this requires not only legal recognition and protection, but also a societal cultural shift to acknowledge and value their contribution. Now let me end this with a positive note and with a recent judgment by the Supreme Court of India, which acknowledges that the worth of a woman looking after a household is of high order. Very recent Supreme Court judgment. And it acknowledges that homemakers' role is as important as salaried family members. So therefore, I'd like to say that India's care economy reveals a landscape that filled with potential, yet fraught with a lot of challenges, and it calls for continued research, dialogue, and innovation. Yes, so thank you for your attention, and I look forward to the discussion. Thank you.
Yeah, thank you so much for that presentation, Sanchari. I will now very quickly, because we are short of time, I'll quickly request Veronica to address the panelists, give us her comments, and come in with her interventions on this.
Bueno, I am talking in Spanish. Thank you. Felicitaciones por los trabajos.
Congratulations for your work. Great reviews on our systems and policies for caregivers. I'll give 3 comments. The first one is on the need to of the caregivers as part of the social reproduction, and the social reproduction has to be the needs and costs distributed amongst everyone within time and money. And that's where the state comes up as with a central role, because through taxes, we may finance fairly caregiving, not just on expenses, but on how they gather these resources. Today, as in most presentations, it was pointed out, most of the financing and caregiving came from the access to salaried work. So women and employees pay taxes, and thanks to that, they have maternity leave license, for example. But the question we must ask ourselves is the system fair? Because, first of all, it leaves aside half of the women that don't work in the formal market, but they are doing informal work at home, unpaid work. On the other hand, it's got breaches and it generates injustice with women and children. For example, since licenses are paid with a percentage of the salary, they have to receive less with those licenses for boys and girls that come from richer women. We should question how much do these systems of social contribution contribute to reduce inequality? The way it's financed currently, it does not allow universal policies. And there is another mechanism, which is tax deduction, which has a justice component, because in some steps that deductions go to big companies, big corporations. And on the other hand, even in Latin America, we have deductions on the care for families that can pay private services. So then, on one hand, we have taxes that should be destined to universal policies, and on the other hand, we benefit people on the private sector, and we're motivating this by making that the tax deductions. In Brazil, a study showed that tax deduction to caregivers benefit white men because they're the ones that can pay private services, and on the other side, the ones that have a high income and can have this as a benefit to pay rent. It doesn't benefit women or Black men. And finally, we have a topic to analyze in the framework of debts. The fiscal laws and norms punish the investment on care because they have a limit on the current cost, and most of the caring costs is regular costs, which is the salary of the caregivers, which is a female role, maintaining the structure. They are health services that have a great component of human resources. So the fiscal norms that limit the investment on spending has a high breach on investment for care. And the fiscal norms and abstinence norms do not value the return on the investment on care, because the care investment has a return on the tax system, It has a return on the gross domestic product, on poverty, and on the women autonomy, and none of that is considered on the care economy, and therefore we should ask how to design universal care system whose access does not depend whether women work or not in the formal system, and it should be available for all men and women that require it and have right to care. On the other hand, how do we finance in a fair way? Because if we finance these universal policies with indirect taxes or tax deductions, what we gain on redistribution, we lose it on the financing side. So strengthening the systems to contribute to inequality between men and women in society, and we don't guarantee the redistribution in the social work. I'll leave it there due to time, and congratulations to those of you that organized this session, because we've learned a lot from the different systems around the world. Thank you.
Thanks so much, Veronica. Do you have any questions in particular for any of the panelists? If not, then I can maybe look at the audience question and answer questions. Otherwise, do let me know if you have any. Veronica?
Mi pregunta tiene que ver cómo
My question has to do with the proposals that we have in order to finance with taxes more fair care services. Maybe each one of you have a proposal. Which ones would those be?
Yeah, would you maybe just do a wrap up 1 minute response to each? So maybe Klelia, if you want, you
Can I
can.
start?
Yeah.
Gracias, Verónica, por tus.
Thank you, Veronica, for your comments and for all your feedback and your hard work, because you have been an inspiration and an invitation as well. For me, I can speak about me personally, for me to get more involved in these subjects. One specific proposal that I believe it mentioned in my presentation, it's important to highlight. Most of the social crises, including care, they see it as a temporary emergency, as a specific situation instead of a systematic issue. And they try to finance it with temporary measures that mainly have an impact with medium class workers. Even like in Argentina, they targeted wealth, but it was for 1 or 2 years during the pandemic, and then they end. So I believe that one of the main recommendations for Latin America would be the care is universal, but it's also structural, and it doesn't have to be linked to temporary measures, especially when we're talking about taxes on one side. Secondly, the common definitions. We wish to have progressive taxes that target the great wealth, and to improve the issue of transparency for the funding to come from tax evasions. I believe that those would be the recommendations in terms of taxes. I believe that's something specific has to come from a continuous and permanent source to target this situation that is permanent, that needs our attention.
Thanks, Klelia. I think we're going to just go 5 minutes. We're going to take 5 more minutes. So I'll very quickly request Meggy to come in and give her interventions. Meggy?
Hello. Yes, sorry. Just to answer the question, very briefly, just to reiterate some of the things that Klelia said. First and foremost, of course, is to reduce unfair tax burdens on women that leave them economically disempowered. And side by side with reducing unfair tax burden, which we consider regressive taxation, we of course promote progressive taxation, as Klelia said, in the form of, say, wealth taxes, corporate income taxes, taxing fairly the ones who should pay their fair share of taxes, to be able to collect the right amount of taxes to be able to domestically build the taxes that are needed for resource mobilization. So for the needs of women, access to water, because the unpaid care work and care work, the needs to be able to support these are embedded within the city. All of those can be answered. The right amount of taxes that are dispersed or utilized through the right fiscal measures. So that's all from me. Thank you.
Thanks, Meggy. Ishmael?
Yeah, so I'll just answer briefly and directly to the question. So yeah, I think we've noted that in our research there's a problem of one, recognizing the gender implications of our tax system. There's a problem of two, funding interventions and policies that look to bring sort of gender balance. So in doing that, I think it's, as Klelia has said, coming up with more progressive tax systems that better target wealthy individuals, those that have the ability to pay. And then secondly, seeing how we can seal the loopholes in our tax system. So on account of incentives, on accounts of various weaknesses in our tax system, there are a lot of resources that are leaving our countries. So if we seal these loopholes, we can better fund initiatives that are specifically targeted at bringing about a better gender balance. So that would be my direct response. Thanks.
Thanks. And finally, Sanchari?
Yeah, hi. I mean, thanks, Veronica, for your insights. That's really important. I mean, the point you have raised. I think I'll also go with Meggy to make it more inclusive. The tax system should be more inclusive. Just to add one point here, that I think India has an income tax exemption in terms of childcare and child education to some extent, but maybe we can definitely should extend it to having a more inclusive taxation policy that also can take into consideration different childcare aspect, as for example, just tax exemption of CRIS facilities. It can benefit many. So yeah, a few small